And good evening, everybody. Welcome to another edition of Cruz Inc. Radio 102.8 Live TV. It is Thursday evening, July the 16th, and it is 5:34 p.m. here in the Cap City. And want to thank our gold sponsors this evening for allowing us to be here. Miss Pamela Jones, thank you so much for sponsoring this show. Dr. Jonathan Shepard, want to thank you, our psychiatrist up in Baltimore. You're going to be hearing a lot more about him. And also activist and radio personality here in Richmond, Clovia Lawrence, thank you. And the citizens of the 8th District, where I live, thank you all for supporting this telecast and the organization as well. And definitely want to give a big shout out to all of the ER staff, ICU, respiratory therapists, everybody that takes care of our loved ones. You all don't know what a tremendous burden that is. And we're so happy to have an ER doctor with us this evening. You all have seen him many times. This is his third time on our show, and of course he's nationally known, got his own podcast. And Dr. Varner, what's going on?
Hey, what's up, my brother? Have not seen you in a while. How are you?
I'm fine, man. How about yourself?
I'm doing well. Hanging on in there.
Good, man. You got a lot of things going on, Doc. So how is life in terms of balancing everything with the show, things that the hospital and family life?
Life is about creating balance, and you just having the show today at 5:30 versus your like regular schedule time is part of that balance. Me and my wife have just agreed that after 6, I shut it down. In this case, for you, it'd be 6:15 or like 6:30. But it's about providing balance and giving focused attention to the family and to the kids once I reach a certain point.
Absolutely. And I want you to, for our audience that's again tuning in and will be tuning in later on as we share this broadcast, give them some of your background.
Okay, as relates to, I grew up here in Prince George's County, Maryland. I'm a board certified emergency medicine physician. I did my undergraduate at Hampton, Hampton the house, and went on to Harvard, Hopkins, Wayne State, and worked there as well. And now I am the medical director of a company called Lifeline Medical, LLC, consulting. And part of that is I've got a brand called Split Seconds. Basically, I teach executives around the world how to make split-second decisions. And in other words, look at it this way. If you're one of those people who have a problem making decisions, then you may want to lean towards me. But if you're one of those people who have a problem making emergency decisions during crisis, you definitely want to lean towards me, because if you have not practiced it or been trained in it, then you are just guessing. And then just to bring about, so as a result of COVID, I have slowed down the split seconds arm, still doing it, still very active, but I'm on the front lines treating patients at a number of different hospitals.
Let's talk about this for just a moment here. Your book, Split Second Decisions, and then, of course, you can see that they can find that on Amazon. When was the release date on this?
That was July 7th, and just as a side note, it went to the bestseller list that day. So anyone in your audience, including you too, Mr. Cruz, thank you all for your support for that.
Absolutely. Again, it's when I think about it every day, and this is something I learned from you, is that we make thousands of decisions, and they're going to impact us one way or other. And even when we don't make a decision, we've made a decision.
You are so wise. And in other words, we all make about 35,000 decisions every day. And from what to wear, what color shoes, or what to eat. Most of them are mundane, don't even matter. But about 1 or 2% of those are life-changing and life-altering. If you are trained and learn how to maximize those 1 or 2% what are known as split second decisions, then you will maximize, you will increase your overall decision making IQ. One of the points is just what you had up on the screen. No decision is a decision, meaning that if you fail to make a decision, or if you choose not to, that's a decision in and of itself. And when you do that, you leave it up to the environment, circumstances, or someone else who may be less skilled to make that decision. But Mr. Cruz, I gotta thank you again so much just for having me here, and thank you for what you do for the community as well.
Well, thank you, and certainly, again, we are just honored to have you because your schedule is so busy. And we want to thank your family for allowing you some time. And we're going to make sure that we're cognizant of that fact, and we're very respectful that we get you out of that big chair and back to your family on time, because we want you to come back, and we don't want to have no issue with Mrs. Varner, at all. So, man, we are going to a hotbed topic tonight, and we're going to be talking about what is a national debate all across the country, and that is reopening schools, whether schools are safe enough to open or not. And before we drill down into the conversation, I want to play something from it was a CNN commentator and our Secretary of State, Miss Betsy DeVos. So I want everybody to be listening to this, because it's going to be interesting here, because it's going to be a question that everybody's asking that this young lady asked her.
You said this week, quote, that there's nothing in the data that suggests it would not be appropriate to have kids in school. So I want to take a look at that data. The U.S. hit a record number of new cases on Friday. The number of new cases per day is higher now in 45 of the 50 states than when schools shut down in March. Hospitalizations are climbing in several states, and some ICUs are at or near capacity. So yes or no, can you assure students, teachers, parents that they will not get coronavirus because they're going back to school?
Well, the key is that kids have to get back to school, and we know there are going to be hot spots, and those need to be dealt with on a case-by-case basis. But the rule should be that kids go back to school this fall. They've been missing months of learning. Many of them are going to be so far behind, it's difficult to catch up. And we know that this is a matter of their health in a multitude of factors or multitude of dimensions. We know that their emotional well-being, their mental well-being, and particularly for kids from low-income and vulnerable populations, this is devastating to be out of school and not learning for months on end.
Madam Secretary, I don't think anybody disagrees with that. I mean, I'm a parent. I want my school-age child to go back to school as much as you are saying you want for everybody. But the question is, can it happen safely? So can you, by saying what you just said, also assure parents, students, children, everybody who's there, that they're going to be able to do so safely?
All right. Now, that's the question right there. And I know most people, I don't know if they took note of how she kind of skirted that question the first time. And the young lady brought it back to her again. Can we safely reopen the schools? And if so, I know that every jurisdiction is different, and everybody is doing different things. And let me say this, your disclaimer here that we always put out here, I love what you do. This is not medical advice, but this is for informational purposes.
Thank you very much. Thank you very much. Well, it's funny because she did skirt around the issue, and correctly so. I'm not sure if there's one answer. In fact, I know there's not one answer. I say that the answer is more likely it depends. It depends on a number of factors, a number of circumstances. I sit on a few governmental committees, have had a moment to interact with presidents of colleges throughout the country, one-on-ones, and they're struggling with the same issue. And one thing that I've concluded is that, as I've already stated, there is no one answer. And then two, it gets complicated. It gets complicated with each family, and each family just like needs to like recognize that you've got to do what's right for your child. You've got to do what's right for the family, and you've got to be ready to make a different decision if you decide one thing and you see it's not working out.
Let's drill down into that, because one of the things that I'm very passionate about is this particular topic, and I make no bones about it. I have been an instructor at the middle school level, elementary level, and high school, and I've been very adamant about it's easy to make a decision when you don't have any skin in the game. Mm-hmm. And I want to say this, and I want you to elaborate on this. I don't know, and I'm not saying per se, but I don't know if Betsy DeVoe or any of the current administration have people in their children in public schools. And so now, not having any skin in the game, as you said, this is complicated, but they're making it seem so easy. Just send them back to school.
Yeah. I think you bring up a good point. And let me say that she probably, I don't know her, but I think that everyone's circumstance is like different. And I think just to right set this, and just to let your audience know where I'm coming from, and even my biases. At first, I was of the position, yes, of course, kids should stay home because that's what's safe for them. But then the more research I read, the more I did. And then the American Academy of Pediatrics came out with this statement. And by the way, the American Academy of Pediatrics forever has been known as the most supportive organization as relates to like kids. They put kids' issues, children's issues, number one at the forefront, using compassion and care. But here's what the American Academy of Pediatrics put out. We strongly advocate that all policy considerations for the coming school year should start with the goal of having students physically present in school. Did you hear them say it should start with that goal? And so if you drill down a little further, and by the way, that didn't sway me, just that statement, it just made me drill down further. And because of my, I'm an emergency medicine physician, I am a father, and I'm a Christian. And I say that to say it's something about being concerned about the least of us that we all have to think about. Because don't forget, we've always said we're in this together. No matter what the government says, and that's technically true. No matter what color you're, black, white, purple, green, the numbers are showing. We are truly all in this together. But let me go on and make my point. If that is the case, just let me walk you through a few things.
Go right ahead.
A lot of the social services are tied to the school and extended school programs. What do I mean? For example, the number of child abuse case reports, number of people reporting child abuse are down 94%. You notice I did not say that child abuse is down 94%. And the reason for that is when you tease it out, most of the child abuse case reports come from school or something surrounding some school event where somebody sees something or the student talks to somebody. What am I saying here? Someone has to lay an eye on these kids, because over 80% of the time, based upon history, the abused child is living with the abuser. So someone needs to lay an eye on these on these children regularly. So that is one reason. That's being concerned about the least of us. And then finally, there are a lot of social services like lunches and breakfasts that are tied to these schools. And also for people, and studies are very clear, children with special needs, children with learning difficulties, they're falling behind. And that's why my position and has kind of evolved, which is there's some risk we're all going to have to take anyways. And because we've got to be concerned about the least of those, I am in favor of a policy that at least starts off with trying to get the kids back in school.
And and this is a very difficult situation because, again, being an educator, a former educator, you know the importance of everybody getting back in. But today, Doc, I'm going to take kind of like an adversary role here. I'm going to be throwing some things out. One of the things that, and you talked about this on your show, is that not having the kids per se move around, but having perhaps the teachers to come to different rooms. Outline that for us in terms of how that would be even more helpful. Again, and let me say to our audience, we're just talking about options here, which every school district in America is probably talking about the same thing, is how do we make this work?
That is a great question. And part of what you're talking about is I've divided how to look at it as outside of the school, what's going on outside of the school, and factors related to what's in school.
Mm-hmm.
I have not talked about yet, and I will tomorrow or on Monday talk about what's going on at home as well. But as it relates to my recommendation about as a consideration, everything I say is a consideration, it's a data point to weigh is that is your school, are they going to have the children switching classes, or to have the teachers switching classes? Based upon what I have read, based upon what I understood about what I understand about the COVID virus, it's better to have that one individual switching classes. And people say, well, what if that teacher has the virus? Well, first of all, the teacher should have on a mask, because that's one of the recommendations, is that it must be, there's some things that are non-negotiable, which is it should be understood that the teacher's going to wear a mask and that the children are going to wear a mask. But back to the teacher. If the teacher has on a mask and the kids have on a mask, it's less risk of any transmission at all. So I think it's relatively, it's safest of all options to have the teacher move. Whereas if the kids move, depending on how many kids are infected, you have those infected kids moving around. Not only that, you have another group of kids coming to the same desk as the possibly infected child. So just from a mathematical point of view, it makes sense to limit the movement of children. And children, teenagers, high school.
All right. Well, again, I'm playing the devil's advocate here today.
The devil doesn't need an advocate, but we can have an educational talk, sure.
Absolutely. And this is what this is, because there's no contention between us. One of the things that we know that our teachers are already underpaid. And now we're asking them to go into a situation where there is perhaps, quote unquote, some risk. I guess the thing would be is if I'm a teacher and I'm already doing normal, and I say normal school years, I'm dealing with a lot of difficulties anyway. And you're going to ask me to go into an environment where I can possibly endanger myself, other staff members, and children, but there is no compensation for that. Would you be a proponent as a parent saying that teachers should get some type of hazard pay to teach our kids?
I think that in an ideal world, that is reasonable. However, this is COVID. Let's take the frontline people, the nurses, the techs, the doctors, the clerks. People love to say that this was part of the job. Ooh, what? No, never when I was going through medical school and even practicing. No one said that a disease would come that I could get infected and take it home and kill my family. No, so let's rid ourselves of that. However, having said that, if I could, I will frame it this way. If I could cast a deciding vote of would teachers get hazard pay, would I cast in favor of it? Absolutely. Absolutely. But as a teacher, if I were a teacher, I'm not sure that would be the deciding factor. That would be incentive. And by the way, I do think that, notice that they said it should be that the American Academy of Pediatrics said it should be a goal of having students physically present in school. They didn't say full time. So, having students in class 2 days a week, it minimizes the teacher's risk. It minimizes the student's risk. So again, I've looked at hundreds of school systems, spoke to several college presidents, and let me not throw them in there because my comments are solely about K through 12. but everybody's doing it differently.
All right. And, some of these questions that when I was talking about this and just talking with people in general, because people have strong opinions, one question came up, and I'm going to get back to the numbers here in just a few minutes. That somebody said, okay, the janitorial staff, when kids are going into the restrooms, who is going to stay in there and wipe down every particular time a student goes to the restroom based on the sheer volume? And then if we're having supply issues already, where they and again, I'm not expecting for you to answer, but these are just some of the concerns. Where's the cleaning supplies going to come from if we having shortages of Lysol and things like that? These are things that are coming to people's mind. Let's talk about the probability, first of all, of someone going in each time, because I heard you say earlier, I think it was in broadcast, about them wiping down the desk and having somebody to come in there, not just the teacher wiping down, but somebody that's an expert in cleaning. Do you think the schools are, first of all, we're going to talk about budget. We know they're going to say we don't have the budget for that, but is that practical to have someone in there during the times that the kids are in school to make sure everything is sanitized?
Well, let me frame this as a decision question. So let me back in this. So you already know I'm a split second decisions expert. Let me define what split second decision is. It's called the TLC framework, and I don't mean 10 to 11 care. It's when there's a time constraint, L, lack of information, and critical consequences. As it relates to the question of who's going to do all that, everyone needs to be clear. That's not a split second decision. There will be a focused, orchestrated, practical effort to decide that that's the pathway they're going to take. If they choose that, then I'm expecting a COO level or whoever organizes it to implement it. From a practical point of view, are there companies out there who will make sure that happens? I think so. But you alluded to, and Cruz, you are slowly walking into that point. So if you don't mind, what he's talking about is I did a part two of factors as it relates to like school that parents should think about. Let me just run through them just real quick.
Absolutely.
It is, we already talked about masks, and students and staff must wear. Students and staff must wear masks. It must be social. It must be social distancing. Teachers should change. Students should change classes, not students. And the plan to clean every desk after every cohort has been in there, and then also to clean bathrooms. And then as well, there must be a form of aeration within the class, meaning a fan, windows open, because we all know that it takes a concentration of virus to cause an infection. And if there's a fan going and windows are open, it dissipates it. It decreases that concentration. If I'm gonna have a practical answer to your question, it's difficult. It's difficult if you've got a bunch of kids in there, but don't forget, all the kids should not be in school at the same time. And you just screwed me. I've got to add to my list. It should not be the school's plan to have all the children in school at the same time. That is a great point.
Again, and this is just a conversation that you and I are having, because you and I don't sit on many school boards, and we're having some information here for the audience. I want to just talk about the numbers real quick, because I have another point leading up to this. According to Johns Hopkins University, as of yesterday, there were 3.4 million people infected and over 137,419 deaths. And just in Jerusalem, there was a report that came out this morning where it says that, again, they're having to perhaps get into that second wave now, and that the infection rate is 50-fold. I'm like, I can't even fathom 50-fold. So understanding that, again, we talked about during the fall that the COVID is more prevalent. And so we're saying that perhaps having our students back in school, in some cases in the fall. So do we primarily let them go to school up until right about October, pull them back out? Or again, is this going to be one of those case by case things with surging numbers and what seems to be coming a second wave of the infection?
That's a great question, and Mr. Cruz, let me commend you. You are I do hundreds of shows, really, literally, and sometimes with an audience of like 40 million. And you are the most prepared host I have ever had. Yeah, those guys sit up. So let's just talk about this second wave. And an answer to your question is: are we saying that we should start the kids and pull them out? I'm saying that if we have to start them and pull them out, then we start them and pull them out. There are some college programs, there are some colleges that's their plan, to start the kids, condense the semester, make it in person, and then the remainder of the class is out of person. And let me add a practical part of this. And Cruz, I forgot how old your like children are, but I've got a 14-year-old and a 17-year-old at home. And I got good kids. I love them, and you can check out some of the videos on my Facebook.
Right.
But I've got to admit, I was on this rah kids should, let's keep the kids safe and keep them home. And then I read the American Academy of Pediatrics, so I started to like change. They just announced in my district yesterday that kids are staying home until January. And I've got to admit, I kind of feel like I need a break. I was like, whoa, no, seriously. I mean, I'm just talking about, I'm not even being funny here.
Yeah,
so if you
exactly.
say that my kids go to school from September to October, cool. It gives me a mental break, because what we already talked about, and I know your host, one of your guests, Jonathan Shepard's talked about it, which is there's a second pandemic going on. There's a mental health pandemic. Fortunately, God has blessed us with a life that, you know, we can spread out and go to different places. But imagine being in a smaller place with two teenagers.
Right.
You know, so and imagine being a smaller kids or a single parent. So there's a real mental health component to it. And let me comment on the last part. The second wave. There may not be a second wave coming because we're not getting past this first wave. We're not getting past it. If you recall, I'm sorry that I was right. I talked about it on the second time that I was on your show. I said, if we don't do what we're supposed to, we're going to be up at 250,000 deaths, and we're never going to get past this. Now, do you know we're approximately looking at 300,000 deaths by January 1st? You know, so and by the way, to your audience, I don't say it till I scare you. I tell you that to say, hey, we have to be vigilant. We've got to be on our game here.
Absolutely. And if you guys want to see that telecast, you can go to, and this is a shameless plug here, you can go to our YouTube channel, and it is there, or you can go to our website page and look at any of the broadcasts that we've had. You see Dr. Varner, again, has been with us, and what he alluded to is out there so that you guys can go back and see it. This one telecast will also be on our YouTube page. It will be shared through 20 other different pages across social media. So if you miss it, you're just not tuning in, you're like, oh, what they talking about, you'll be able to go back and see the entire conversation. So I want to throw that in there real quick. Got another just kind of mind-blowing thing. I don't know exactly what district this was in, but it was all over social media, and I had to verify before I mention anything that's on social media. I always try to verify. There's a school district that's asking parents to sign a death waiver for the students. Doc, you're ER, Doc. Is it that serious where we have to, before we send our kids back, or is this perhaps a school district just being proactive, trying to cover their butts, or, you know, what is your opinion? Again, I'm asking your opinion about that.
And thank you for giving me the leeway of making sure it's my opinion. There's no medical basis for this because I didn't even I have no information about it. But it sounds to me, based upon my experience, that there's some gamesmanship going on here. To ask a parent to sign a death waiver, I've never heard of such. So I'm sure there's some politics going on behind it. But I need to tend to your audience, which is everyone keep in mind that 97% of us adults, of us overall, even if we get COVID, we will do just fine. And 99.9% of children, if they get COVID, will do just fine. Now, there are some considerations as it relates to your child. If your child has certain risk factors, then it's another data point. Don't forget, I've just been presenting data points. It's another data point. If your child has underlying lung disease or any type of interstitial disease, and by the way, at the level that I'm talking about, you would already know about it. Or believe it or not, here, and follow me on everyone. If your child is obese, it's just a data point. That is a risk factor. Have you ever wondered, well, why are the younger people in this country being impacted as it relates to Wuhan, China, where they didn't experience this? Part of the information coming out now is obesity. Obesity is a big risk factor, and obesity in children. But more broadly, for instance, it was determined that of the ICU admissions in the UK, in the United Kingdom, 75% of them were overweight. What the studies are showing here is that we have an obesity problem, but that for the kids. So youth grants you a certain amount of protection from COVID. You may get it, but you're going to do relatively fine. But what they're finding is that for obese children or overweight children, you lose some of that protection. That's put in the most non-technical way. I say all that to say there are a number of factors that you have to throw in there. In no way am I saying that if you have an obese child, don't send them to school. No, I'm just saying that's another risk factor to weigh in there. And again, parents, 99.99% of children are going to do just fine. And this is scary. And to you parents who are saying, hey, I've got to work, I have to send my kids to school. It's okay. It's okay. Not everybody has that luxury. If you got to work, you send your kids to school. Send them with some masks, some gowns, and just keep them well nourished. Keep them de-stressed. So it's going to be okay if you don't want to send your kids and you have to send them. But fortunately, I have a feeling that decision is going to be made for many of us. School districts are going to gradually come out as it relates to this.
You just mentioned something that I picked up on, and I'm going to make sure that we get out here on time. We got about 9 minutes here.
No, you take 14.
All right. Well, de-stressing, because again, you mentioned this before in some of your broadcasts, is that how we as parents and how our kids pick up on things and how we have to be careful not to layer our stress on them. So if we make it a big deal and put that stress on our kids, again, in your opinion, are we being more harmful and perhaps even detrimental to their learning capacity? Because now they're having to go to school, they're wearing masks. This is all a new environment for them. Should we be trying to encourage them with what you're saying, that again, 99.9% of those young kids that perhaps may be infected, or us that may be affected, going to be fine? It's like basically getting over, I won't say, I don't want to minimize it, but dealing with the flu. There's some precautions we have to take. How do we ease the minds of the parents to ease the mind of the children?
I think, again, your questions comes from a source of a wealth of information. It's clear in your question that you've done a lot of reading about this. Very broadly, stress does not help anybody. In fact, it allows COVID to thrive. Why? Because we have a naturally occurring called cortisol, and it causes our naturally occurring hormone cortisol to rise. With that, studies have shown that chronically elevated levels of cortisol causes transient or short-term decreases in our immune system. And that impacts everybody. And I know I walked through that fast. So if you go to my YouTube channel at Dr. Geoffrey, Geoffrey, I walk people through that slowly. But that's more broadly. As it relates to children, keep in mind, it's not till our children are about the age of 24, 25 that their prefrontal cortex is fully developed, meaning their coping area of their brain, their ability to cope and manage stress. That's not even fully developed to 23, 24. Therefore, if you've got younger kids, you have to encourage them. You've got to make them seem like things. You've got to make them think that things are good, are like okay. Maslow's hierarchy of needs, it talks about safety. You have to make your children feel safe. And even if you're scared, you've got to reach down there and hold that. You can be scared for a moment when they are not around, but don't stay there. You give yourself 5 minutes, but then you've got to move on past it. Why? Because there's a lot going on in this world, and we are all, on some level, called to change the world. Why? Because the world needs to be changed, and it's the right thing to do. And the way you may be changing the world are through your kids and how you interact with them and how comfortable you make them feel. And again, it's all going to be okay. And in fact, in my book, Train Your Mind, Split-Second Decisions, there's a whole section that talks about fear and dealing with your fear and moving past fear. And let me be very clear. This is a fearful period of time, but fear is not of God. But sometimes you like have it and you move past it, and getting past it is absolutely essential. And sometimes you may even have to let your fears motivate you. But again, people, we're in this together, doing what's in the best interest of our children. And if you make a decision, it may be the wrong one. And you know what you do? Make a different one. That's what messes people up. Okay, I gave you all one of the nuggets of my book. But that's one of the biggest things is that people make a decision. It doesn't give them the results they want, and they're paralyzed. They fail to make another one. Hey, you're wrong. Be prepared for the next one.
But that is just like golden right there. You know, that would trade anywhere on the stock exchange. That information that you just provided. Let's kind of reel things in here, because I want to again, you are Renown, probably one of the I'm going to say the world's most informative people when it comes to split decisions. There's going to become crunch time in the fourth quarter here, where the district is saying, okay, we've been talking about it. Now it's time to put in place the go time to go into school. Split decision time. Do I trust the government enough? Do I trust my administrators enough to put my children in this position? Split decision. What are some of the things, again, if you can kind of encapsulate what they should be looking at in terms of helping them to make a decision that, again, they can feel good with it. We don't have all the answers because everybody is different, but just to kind of ease their mind about what factors they need to be considering, perhaps.
Well, let me frame it this way, and this is the concept within the book. Your first decision is likely your best decision, meaning that unless you have new and additional information, your first decision is probably your best one. Here's why. Most of our decisions, about 81% of them, come from our subconscious. That's an area that we don't have direct access to, but it informs our consciousness about the decision. What's my point? My point is that your subconscious has already weighed in there on information you didn't even think about. Mm-hmm. Therefore, your first decision is likely your best one unless you have new and improved information. But parents, let me empower you. You can write this down, but there's some factors to consider outside of the school. For instance, and again, these are data points, and write these 4 data points down, but you can add to them. Like, you want to know what's going on in your community, what's going on in your area. Look at the hospitalizations trend. Notice I didn't say the number of hospitalized patients, but the trend. Is it moving upwards or is it moving downwards? You want to look at, and this gets more granular, look at the number of ICU admissions. Look at that trend. And then also look at the number of deaths. Now let's talk about the number of deaths. The number of deaths, it really tells you about what's going on in the community about 2 weeks ago. Because it takes about 14 days. Once you contract COVID, if you're not going to have a good outcome and you're going to die, it takes about 14 days. And then finally, look at your positivity rate. Your positivity rate. That's the percent of those who test positive who are tested. All those are just data points as it relates to what's going on with the virus within your community. Now, obviously, if you're looking at hospital admissions and the closest hospital is 200 miles from you, it's still a data point, but you just don't weigh it as heavily.
Right.
But knowing what's going on in your community is key, because if you're someplace and you all have one case in 100,000, then you don't have to worry about it, really, right? But if you're someplace where you've got 100 cases in 100,000, then you've got to weigh that in there. And be kind to yourself. Don't be too hard. You're going to write a list. You're going to change it several times. In full honesty, I want to give people, I started off this project. Here's the clear signs that you should or should not go to school. The more I read, the more people I talked to, I was like, whoa, it's not as simple as that. What's my point? The point is, you've got to be willing to be open and say, hey, I need to think about this, or I need to adjust this data point. Makes sense to you, Mr. Cruz?
Absolutely. And again, I want to thank you for taking time out of your schedule. I want to close with talking about the book. And I want to go back again and talk about TLC one more time, not the tender loving care. Again, I'll break that down because I use that every day here at TLC.
It's called the TLC framework. And it's the T stands for a time constraint. And I'm going to go back to that one too. L, a lack of information. And then C, critical consequence. Here's the first time that I've said this publicly. I do it during my live paid talks. But the time constraint, while the book's name Split Second Decisions, the time constraint part is not necessarily in seconds. It can be minutes, it can be hours, and even days, meaning that any circumstance where you suddenly have less time than what you normally would. It's less time. Just so happen often it is seconds. So it's called the TLC framework. And if you don't have a framework for making decisions, especially during critical times, then you're just guessing. You want to be trained so that when it happens, you are ready. Now, as it relates to the book, I want to thank you very, very much. It is a bestseller. And to be honest with you, and I say this humbly, I am the only person in the country who has a bestseller book out. It's called Home Alive, 11 Must Steps for Surviving Encounters with the Police. Came out in 2017. It teaches males how to make split-second decisions when interacting with the police. And now I have this new bestseller called Train Your Mind in Split Seconds. A part of that teaches first responders how to make split seconds. So it deals with both bookends. And I would encourage you, any of your guests who even buy it, I will give you a money back guarantee. You can read that book and say, Dr. Geoffrey, I didn't like it or I didn't learn anything. Email me, I'll cash app it to you, and you are good. And I've offered that. No one's ever. Everyone says, "Hey, it changed me."
I want to come back and I want to get the book, read it, and then let's come back and have a discussion about, because we're seeing time and time again confrontations with the police department. We just had video released here in our area with the Virginia State Police had a conversation with a young man, and the police officer looked at the camera, looked at him, and said, "Man, I am one hell of a specimen, and people about to see you get your butt beat in front of all your little friends." I'm like, wow. With everything that has transpired over the last 4 or 5 weeks since Ahmaud Arbery and George Floyd, we still have a gap. And again, we need to, as you just indicated, we got to teach our young people how to de-escalate a situation, because unfortunately, not saying, because I have a lot of friends on the force, they've come over to the house recently and we've had these discussions, but unfortunately we have some bad characters in any situation. It don't count what color they are, where they come from. We just know we got some bad apples out here. So I think your book is, we need to come back, have a discussion just like we did today. And I think that it's going to help somebody. In fact, I know it will.
Good. I am all for it. My goal in life, as I'm changing the world, is to encourage and inform. And I am uniquely placed, and God has blessed me, and I've had experiences which I think that will be helpful to many.
Well, thank you again for taking time out of your schedule today, man. It's always a joy to have you on. And, I can't say enough. And I want to say this in closing while you're on here is that, again, Dr. Varner and myself, we understand that we are providing information. Mm-hmm. We're not telling anybody what to do, because you have to make that decision based on your household. As he said, what's going on in your community, what information you have before you at that time. So we had the discussion. As you can see, it is not cut and dry. I was like you at first. Part of me says, yeah, let's not do that. And then I had a conversation with my son, also, who's one of the, I don't know what generation he's in. He's 39, so I don't know that generation name. But, he was saying, Dad, there's pros and cons to all this. And I thank God for a wise son. So maybe somewhere I did something right along the way.
Sounds like you did.
So, man, thank you so much. Tell the family and wife, everybody, thank you for loaning you to us for these last 40 minutes.
Thank you very much. And they're sitting right here ready for me to go to dinner. So,
all right. And very much. Show them what put this up one more time. Please tell them about that book once again.
It's called Train Your Mind, Split Second Decisions. They can go to Amazon and put in Dr. Geoffrey, Geoffrey Mount Varner, Mount Varner. You can go to the website to contact me, but the book's not available on the website. You can go to Amazon, and when you buy it, please go back and leave a review of the book as well. And one thing that I will assure you, you will come out of that book having felt encouraged, maybe even laughed, or definitely you would have learned something.
All right, man. Go eat dinner. Have a good night. Certainly appreciate you being here. Everybody, thank you for watching Cruz Inc. Radio 102.8 TV. Thank my brother again for being here with us. And we're going to talk offline, because I see your face.
You stepped it up. You got the intro going on. You got the end part. In Cruz, you have stepped it up, sir.
Oh, wait. I'm like a kid at Christmas here, so I got some more tricks, man. Have a good evening.
I want Christmas to come here, too.
I got you.
All right, brother. I'll talk to you soon.
All right. Take care. All right, everybody. Again, thank you for joining us. We certainly appreciate you taking time out of your schedule this evening. As we talked about the serious subject, reopening schools, yes or no. And as you can see from our conversation this evening, there is no clear point of reference in terms of yes or no. It's not that black and white. So again, you have to look at what is good for your family, what's conducive for your community. And as the good doctor talked about, you got to look at community trends. You also have to look at ICU admissions. You also have to look at the number of deaths in your area, your vicinity, and you also have to look at the positivity rate. And again, we all know in the Richmond area, our positivity rate is ticking up. There has been some surges. So please wear your mask, make sure you're social distancing, wash your hands. We're in this together. Everybody be safe. Have a blessed evening, and we will be back next week. So I got some more guests coming on next week that you're going to be wanting to hear about. We just got an array of things going on here at Cruz Inc. Radio and Cruz Inc. Media and Marketing. Thanks, everybody, for supporting us. And also, I want to say welcome back to Oshawa Henderson. You're going to be seeing more from her in terms of our radio personality out there in the streets, bringing you all type of current events and reports and interviews. So again, welcome back, Ms. Henderson. Thanks for coming back to the family, and we look forward to having you right here where I am. Have a great night, everybody.